Hi friends, welcome to the channel Nurse Up. Here we are discussing some frequently asked questions in community health nursing. Please like, share and subscribe my YouTube channel for more upcoming nursing related videos. A patient came to doctor with inflammation of parotid glands, earache and fever. What may be the possible reason? Option A, chickenpox. Option B, measles. Option C, German measles. Option D, mumps. Correct answer is option D, mumps. Mumps is the inflammation of parotid glands with earache and fever. The another name of German measles is option A, rubeola. Option B, rubella. Option C, influenza. Option D, 100 days cough. German measles is otherwise known as rubella. Option B, rubella. Rubella was initially considered to be only a variant of measles or scarlet fever, but in 1814 it was first described as a separate disease in the German medical literature. That's why it is otherwise known as German measles. The name rubella derived from a Latin language, so it means little red. Measles vaccine is a option A, killed vaccine. Option B, live vaccine. Option C, toxoid. Option D, immunoglobulin. Correct answer is option B, live vaccines. Measles is an example of live vaccine. Koplik spot is the characteristic feature of A, smallpox. B, chickenpox. C, measles. D, rubella. Koplik spot is the characteristic feature of option C, measles. This is Koplik spot. These are the bright red spots with white or bluish white centers. It resembles like grains of sand. This is the very important characteristic feature of measles. The causative organism of chickenpox. Option A, myxovirus. Option B, variola. Option C, varicella. Option D, toga virus. Chickenpox is option C, varicella zoster virus. Then what is variola? It is smallpox. In smallpox, the sequence of typical skin rashes appearance is option A, pustules, vesicles, papule, macule. Option B, macule, papule, vesicle, pustules. Option C, macule, vesicle, papule, pustule. Option D, vesicle, macule, papule, pustule. The correct answer is option B, macule, papule, vesicle and pustules. We will see the characteristics of these lesions. Elevated solid lesion is called a papule. Flat area of altered color or texture is macule. Fluid filled blister is vesicle. Pus filled blister is pustule. In the first picture we can see macule. It is a flat area. Then in papule there is a solid elevation. Come to vesicle, it is a fluid filled lesion. In pustules, these lesions are filled with pus. In case of smallpox, initially it becomes macule, then turns to solid elevation is papule, then it filled with the fluids vesicle, at last it is pustule. The first case came to attention to the investigator is option A, index case. Option B, primary case. Option C, secondary case. Option D, both A and B. The first case came to attention to the investigator is option A, index case. Correct answer is option A. Index case is person that comes to the attention of public health authorities or the first case discovered during an outbreak. Primary case is what? Person who acquires the disease from an exposure or the first case of communicable disease in a population. Then what is secondary case? person who acquires the disease from an exposure to the primary case. The case infected by the primary case is secondary case. Pap smear examination to detect cervical cancer is considered as A. Primordial prevention, B. Primary prevention, C. Secondary prevention, D. Tertiary prevention. Pap smear examination is what? It is a screening test to detect cervical cancer. It will come under option C. Secondary prevention. Always keep in mind that all the screening tests will be coming under secondary prevention. Here we will see the levels of prevention. Primordial prevention include health promotion and health education. Primary prevention includes specific protection against a disease. Secondary prevention include early diagnosis and treatment. Tertiary prevention include disability limitation and rehabilitation. So Pap smear examination is an early screening test to determine cervical cancer. So it will come under secondary prevention. Swine flu is an exotic disease. Exotic means A. Transmitted through H1N1 disease, B. Imported from another country, C. Transmitted through respiratory route, D. None of these. Correct answer is option B. Imported from another country. Polio is a sporadic disease. Sporadic disease means A. Transmission from fecal-oral route, B. It is a spore-forming bacterial disease. Option C. It is a scattered disease. Option D. It is imported from neighbor country. What is sporadic disease? It is a scattered disease. Option C is the correct answer. The term endemic means option A. Outbreak of disease. Option B. Excess of expected occurrences. Option C. Usual occurrence. Option D. Epidemic affecting large population. Endemic means what? Endemic means usual occurrence of a disease. Correct answer is option C. The unexpected occurrence of any disease in a community is termed as option A. Epidemic, option B. Endemic, option C. Pandemic, option D. Holoendemic. The unexpected occurrence of any disease is known as option A. Epidemic. What is endemic? We already discussed now. It is the usual occurrence. Then if a disease is worldwide occurrence, it is known as pandemic. The method of identifying the missing case is known as A. Search surveillance, B. Sentinel surveillance, C. Operational surveillance, D. None of these. Correct answer is option B. Sentinel surveillance. It is the monitoring of rate of occurrence of a specific disease through a voluntary network of doctors, laboratories and public health department with a view to assess stability or change in the health levels of the population. The required amount of chlorine to disinfect 1 liter of water is option A 0.5 mg, option B 1 mg, option C 5 mg, option D 10 mg. Correct answer is option A 0.5 mg. The contact period for chlorination of water is option A 30 minutes, option B 60 minutes, option C 90 minutes, option D 100 minutes. The contact period for chlorination of water. Correct answer is option B 60 minutes. The training period for Anganwadi worker is option A 3 month, option B 4 month, option C 5 month, option D 6 month. An Anganwadi worker should take the training period at least for 4 months. Correct answer is option B 4 months. The main cause of death in children aged between 1 to 12 months is option A low birth weight, option B congenital malformations, option C inappropriate weaning, option D diarrhea. Children aged between 1 to 12 months is called what? Infant. The main cause of death in infant is diarrhea. Correct answer is option D diarrhea. Children below 1 month of age is called what? They are neonates. The main cause of death in neonate is due to low birth weight. Which is not a name of whooping cough? Option A, pertussis. Option B, 100 days of cough. Option C, 90 days cough. Option D, barking cough. Correct answer is option C, 90 days. The other name of whooping cough is pertussis, 100 days of cough and barking cough. After mastectomy, breast prosthesis was implanted for figurement of breast is a option A, primordial prevention, option B, primary prevention, option C, secondary prevention, option D, tertiary prevention. Breast prosthesis implantation will come under rehabilitation. Rehabilitation will go under tertiary prevention. We already discussed all the levels of prevention. What is primordial prevention? It includes health education and health promotion. Primary prevention include action taken to prevent the occurrence of a disease. Secondary prevention include early detection and treatment. And the tertiary prevention include disability management and rehabilitation. Here the correct answer is option D, tertiary prevention. Disability limitation and rehabilitation. A girl regularly doing breast self-examination. Which level of prevention she is following? A, primordial prevention. B, primary prevention. C, secondary prevention. D, tertiary prevention. Breast self-examination is the early detection of or screening test for breast cancer. So all the screening tests will come under secondary prevention. Early detection and treatment will come under secondary prevention. The correct answer is option C, secondary prevention. The most important indicator of health status in India. Option A, maternal mortality rate. Option B, infant mortality rate. Option C, proportional mortality rate. Option D, neonatal mortality rate. The most important indicator of health status in India is option B, infant mortality rate.